Good morning, everyone. My name is Paige Elliott. I'm the Senior Family Support Specialist with Healthy Families at East Bay Community Action. I'm joined today by Kelly Martin, who is the lead parent educator for the Parents as Teachers program at EBCAP. And the two of us are joined by Dr. Sam Zwetjenbaum from the Rhode Island Department of Health. He's here to talk with us today about oral care for your little ones and give some recommendations on how to provide them with the best dental care out there. So I'm going to pass it over to you, Sam, and let you introduce yourself.
Great. Well, thanks, Paige and Kelly, for having me today. I'm going to go ahead and I'm going to share my screen. And I'm just really excited to have everybody who's here today and those who will also be watching it recorded, because I want to talk to you about oral health, that we feel, and I know you probably feel as well, that it's really important for everybody's successful development and being for children to be good learners in school, for children to socialize. But the great news is there are things you can do to prevent dental problems. So just to give you a little background, what is oral health? It's a state of being free from mouth pain, no cancer, no sores, no diseases. And this is really what we want for everybody. We want all Rhode Islanders to have this from the start. And let me just advance my slide. Okay. Interestingly, there's a lot of things that influence oral health. Some people think it's just, oh, just brush your teeth, but it's actually so many things influence oral health. It's the things you eat. It's the behaviors, smoking, and obviously children hopefully are not smoking, but all behaviors can certainly influence oral health. Medical conditions can influence oral health. If somebody has a dry mouth, either from a medical condition or from an asthma medication, they really have become high risk for dental disease. And of course, access to care, whether it's due to finances, due to transportation, all of those influence oral health, as well as access to fluoridated water. Fluoridated water, we're fortunate at Rhode Island, we have really, number one, delicious fluoride, but also 87% of those on public water systems can take advantage of fluoride, which is a natural mineral that helps strengthen teeth. I say it's natural. It's in the water naturally, but in amounts that are not enough to strengthen teeth. So we talk about parts per million. Natural fluoridation, about 0.3 parts per million. Most systems add to 0.7 parts per million, which helps strengthen teeth. So all those influence. Our dental diseases are highly prevalent. Whether it's in the United States, 1 in 4 Americans have untreated tooth decay. 80% have had at least one cavity by age 17, and also gum disease is highly prevalent. You probably know, or maybe you don't know, that dental disease is 5 times more common than asthma. So it's really something that we need to pay attention. How does it happen? How do people have dental disease? And the most common, especially in children, the most common dental disease is tooth decay. You might hear your dentist refer to it as dental caries. And it basically takes bacteria in the mouth. So in this picture, you see those little nasty looking bacteria. The bacteria consume the sugars in the foods we eat to produce an acid. That acid can affect the tooth by causing a cavity. So acids with teeth lead to cavities. If those cavities continue, they can lead to abscesses or infections in other parts of the body. So again, how does a cavity form? Carbohydrates with bacteria lead to acid. The acid with a healthy tooth can lead to a cavity. Now, I will tell you a lot of these materials, I'll show you the website later, they're from Teeth First RI. They have a lot of great resources. And they make these booklets, and I'm happy to send some to you. They're called flip books, and this would be on the other side of the flip book. Gum disease is the other very common dental disease. You might hear the term gingivitis, which means inflammation of the gums, and that's due to plaque. Plaque contains bacteria, and that plaque, if it's sitting next to the gums for a long time, causes inflammation. Inflammation is redness, swelling, ulceration. And if that lasts for a long time, that can enter the bloodstream and affect other parts of the body, whether it's our heart, our lungs, our diabetes, etc., all affected by gum disease. So keeping our teeth cleaned, whether it's children or adults, is really important for overall health. So these are some examples of dental disease. And what I tell people is, if you see anything that looks different from normal, talk to your physician, talk to your dentist, and have it checked out. What we really want is for everybody to have a dental home. That's that ongoing relationship between the dentist and the patient. That's the relationship that if somebody has a problem, they can call the dental office and say, oh yeah, we'll get you in right away. A dental home is one that might send you that card that reminds you to come in every 6 months for a regular dental visit. So we encourage everybody to establish a relationship, and I know we'll talk later about how can you find a dentist. And we've talked about fluoridated water. It's really one of the top 10 public health achievements of the 20th century, and it is sort of the ultimate example of public health. It's an effort that's done for the benefit of the entire community. And we're thinking, especially now with COVID, we think more about public health, but these are initiatives that really help everybody, and we need to encourage. And like I said, fluoride is something that's naturally occurring, and it strengthens the tooth enamel. So fluoride fights cavities, and you can definitely get it through your tap water in most Rhode Island communities. And other ways you get fluoride, through your toothpaste, through efforts that are done at your dentist. And there's something called fluoride varnish that's also done at the dentist. And really having all of these together is what helps make strong teeth. So fluoride is beneficial because it strengthens the enamel. And this is some information that's, again, on those flip books, that if a child lives in a non-fluoridated areas, if they're on well water, say in western Rhode Island, we don't have many public water systems, or in South County, they don't fluoridate the water, then they may need to get a prescription from their physician or dentist for fluoride tablets. Dental disease can be serious. Some people say, look, it's just a child. Why should we care about their tooth? We do know that infections can spread to other parts of the body, and in 2007, a young man by the name of Diamante Driver died of a brain abscess that had originally come from a tooth. And so it reminds us that children's dental care is extremely important. It's not just a baby tooth. It's something that can lead to an infection, and the baby teeth or primary teeth are also critical because they maintain the space for the adult teeth. And also, as I said, it can affect other areas of the body. So, and this I've talked about school success. Many hours of school are lost annually due to dental-related conditions. Of course, if a child has a toothache, they're not going to be able to focus or pay attention. And then for adults as well, their jobs. So again, that's just a little notion to tell you these conditions are preventable. So we're going to talk about oral health across the lifespan, and the first thing to share is for pregnant women, that pregnant women should definitely be going to the dentist, and this is kind of a change. My first job was as a dentist, and if I point out the window, I'm in Providence, and about a mile from here is Capitol Hill Health Center, was my first job as a dentist, and back in the late 80s, I remember pregnant women coming in and saying, I have a toothache, I've been to 3 dentists so far, nobody wants to treat me. And what we would do is, of course, we'd go ahead, because there's nothing we can do in dentistry that's going to harm a pregnant woman, okay? So, but what we would do is we'd say, of course, let's deal with your tooth so you can sleep, so you can eat, so you will stop taking maybe even opioids or pain medications. So we would treat the tooth, of course, but what we didn't say, again, 30-something years ago, is come back so we can do preventive care. Now we know that actually preventive care is important because pregnant women can be at higher risk of tooth problems. They can get severe gum disease. That plaque that I showed you that can cause gingivitis, it actually can be more exuberant because of hormonal reactions in pregnant women. So it's actually really important that pregnant women are comfortable keeping their teeth cleaned. We also know that they're increased risk of tooth decay because of the acids that are naturally produced. And then this is an opportunity to talk about the developing child. So definitely preventive visits are important. Visiting the dentist is safe. It's recommended by ACOG, which is the American Congress of Obstetricians and Gynecologists. And we tell people that if you have morning sickness, if you have an acidic mouth, first rinse out and then don't brush right away because you're going to brush the acids into the teeth. So there's a lot of guidance that can be provided by the dentist and dental hygienist by having a preventive dental visit. So again, this is also from the flip book. It's safe. When you go to the dentist, they put a lead apron on. Actually, radiation nowadays, because of digital radiographs, are much less than they used to be before. When 30-something years ago, it was film X-ray. It used much more. Now, very little radiation. But still, the dentist will put on an apron when they take radiographs. They'll discuss your treatment plan. Cleanings and treatment are totally safe and recommended. Other things, dental tips during pregnancy: visit the dentist regularly, brush and floss, and if you do have vomiting, rinse your mouth out after vomiting because it's low pH. And then, like I said, those x-rays are totally safe. And x-rays are actually, some people say, oh, why do I even need x-rays? My teeth are fine. There's actually a lot of things that you can find on x-rays. So in this picture, you can see that right underneath the crown of the tooth, a cavity was starting, really only visible by an x-ray. So we recommend x-rays probably once a year, more if somebody is high risk, if they seem to be getting a lot of cavities, less if somebody is low risk. If somebody is low risk, they haven't had a cavity in a while, they have a very low sugar diet, they probably can go every couple years with x-rays. So talk to your dentist, and depends on the risk. Okay, I won't go through this. After delivery, this is just sort of, I don't want to say a joke, but this is actually really, this is from old school. This is from many, many years ago. Somebody found these. No, do not give soda to a child. Soda has a lot of sugar. So, but what I want to talk about is what we're really trying to prevent in children is something called early childhood caries. This actually used to be called baby bottle tooth decay because it was associated with putting the child to bed with a bottle. But it can be from milk, it can be from sugar, but we know that some children are highly susceptible, and it's highly related to diet. So what is early childhood caries? It's tooth decay that can come on the primary teeth. And how do we prevent it? Brushing and using a fluoride toothpaste. So we recommend getting into the habit of cleaning the mouth even before the teeth erupt. Teeth are going to be in by 8 months to 1 year roughly, but even before that, use a cloth to wipe the gums after feeding, just so your child gets used to cleaning. And there are some little soft bristle brushes that are out there. We recommend for a young child using just a smear or a rice grain size of toothpaste with fluoride, because that'll just start strengthening the teeth. So again, how much toothpaste? For a child who's under age 2, we recommend that rice grain size. For a child between 2 to 5, use like a pea-sized. Actually, that's what I use. I typically just use a pea-sized for even myself. Okay. What else do we know as far as infants and toddlers? We know there is a bacteria. That bacteria is called Streptococcus mutans. Streptococcus mutans is the bacteria that causes tooth decay, and mothers or fathers can pass that on to the child. So we encourage avoiding wet kisses so we don't transmit bacteria. Do not lick pacifiers or share utensils because it is an infectious disease that you're sharing. Wipe the gums or brush the teeth before bed. No bottle with sweetened liquids at bedtime or nap time. Why? Because if the sugars are on all night long, that's going to contribute to tooth decay. Breastfeeding is very healthy for the teeth, the development of the teeth, the development of the entire orofacial structures. I had actually seen data that at one point that the likelihood of malocclusion or crooked teeth or needing braces is greater in those who are not breastfed. So breastfeeding helps develop a healthy mouth, but if breastfeeding is going to be done, make sure to wipe the baby's gums and brush the teeth more often. Water should only water in the sippy cup. So if you're going to use a sippy cup, the best drink is Rhode Island's tap water, which is fluoridated, or I guess any state's water that's fluoridated. Okay, make clean teeth a habit. So spending 2 minutes brushing a child's teeth is very important. So parents should be responsible for cleaning the child's teeth until they're about 6 years old, or until they can tie their own shoelaces. Children may not have the dexterity or the wherewithal to brush all the surfaces, so parents should be doing it. And it usually takes about 2 minutes. At the early stages, it's helpful to put the child in a position, kind of like a knee-to-knee position, or holding the child. I hopefully have a picture. If I don't, during the Q&A period, I'll pretend with my little dinosaur in the back. Okay, so when do we visit a dentist? We recommend a dental visit by age 1. So a first visit by his or her first birthday is a good rule of thumb. Why? We don't want to wait till the child has a problem. We want the child to be comfortable going to the dentist, so early visits introduce the child to the dentist. Also, the dentist can provide guidance to the parents. We don't expect parents to know everything about good oral health, good diet, and fluoride. So this is an opportunity to teach and share information. Okay. So again, the first visit should be at age 1. Now, what you're seeing here is an example of what's called a knee-to-knee examination. Here, let's look on the upper right. On the upper right, you see the dentist is on the left side, and she has the child's head in her lap, and mom is on the right side, and the dentist can look right in the kid's mouth, and so can mom. And the child is looking right at mom, and it feels comfortable. So this is what we call a knee-to-knee examination. This is not taking place in a traditional dental chair. So again, thinking 30 years ago when I was at Capitol Hill Health Center and somebody said to me, at what age should I bring my child? I might have said something like 3 or 4, because I was thinking, well, when can a child fit in a dental chair? The child doesn't need to go in the dental chair. They can go in this, what we call a knee-to-knee examination. So whoever invented knee-to-knee examination was quite brilliant, because the child feels very comfortable. The dentist is able to look in. Now, will the child cry? Yeah, they may cry, but that helps give a better view. Okay, so that's an example of knee-to-knee examination. We want to encourage parents to be very positive about going to the dentist. If you say to the child, oh gosh, I'm glad it's you going, not me, the child's going to be like, oh my God, what should I be worried about? So go early in the day, arrive early so you don't feel rushed. Be very positive about it. If you say things like, oh, if you're good at the dentist, you'll get a treat, the kid's going to say, wait, is there something I should be worried about? Okay, so I wanted to mention that. The other thing I wanted to mention is there are a ton of books. Okay, this one, I don't know why the only example I could find on my desk is in Hebrew, but this is Dora the Explorer Goes to the Dentist. So start reading to your child. If you're a regular reader to your child, if you can read a book about going to the dentist, I think that also just gets people excited. Ooh, you're going to the dentist, just like Dora does. Okay, so I wanted to share that. The next thing I wanted to talk about the 3+ child. Brush twice daily with a pea-sized amount of fluoride toothpaste. That's the right amount. You get the healthy fluoride on the teeth. Parents should brush until the child has enough dexterity, like I said, to tie their own shoelaces, but I recognize that now they use Velcro. Okay, flossing. Floss between teeth that touch. That helps the teeth. And I'm sorry I don't have a good demo model, but teeth have multiple surfaces. There's the outside surface of the tooth that faces the cheek, the surface of the tooth that faces the tongue, and then there's the biting surface, but there's also surfaces between the teeth. So use the floss to get those areas. Limit juice and milk to meal times only. Fluoridated water between meals and in travel cups. Avoid those sticky fruit snacks. The other thing I would say is the other thing that causes problems with kids is falls. So if a kid falls in the house and breaks their teeth or a tooth comes out, obviously your dentist is going to be able to help you with that. But let's avoid that by prevention. Just keeping the house clean, getting rid of all the toys on the floor so the kid doesn't fall. The other thing is covering the little electric sockets with those little protectors, so that we have seen kids who've had electrical burns by trying to, lick the electrical sockets or things like that. So, yeah, only allow kids to brush their own teeth once they can tie their shoes. It's great to just give them, let them develop their own skills if you're going to do that, but have them, the parent should follow up to make sure they're doing a good job. Okay, diet makes a huge difference for teeth, and we know that there are good choices for our teeth and bad choices. The bad choices are usually those really acidic and sugary foods. Good choices are cheese, vegetables, yogurt, and fruits and vegetables are really good for the teeth, but processed things. And again, juice is probably not so good. But if you're going to do juice, make sure to follow it up by good brushing. Okay, and the reason why, so we think about pH. A low pH means a food is very acidic, and if we constantly have low pH attacks all day long on our teeth, it's going to lead to tooth decay. Okay. Sticky foods are not good. All these foods are really sticky. And again, look, you might think I'm a saint that I never have cookies and candy. It's fine to have it once in a while for a treat. But if cookies and candy become the norm, even worse, if it's all day long, this stuff is going to be on the teeth. That's definitely going to lead to tooth decay. It's fine to have a treat, but concentrate it at one time and then brush right after. Okay? Even drinks. Drinks are very much can have sugar. Juice boxes have a lot of sugar. Soda. Even Pediasure. All those things have, look, what I'm showing on this picture is the number of teaspoons of sugar in each one. You'd never think to have that much sugar. So just make sure you're following, limit this to just those rare special occasions, or and if you're going to have it, brush afterwards. I mentioned fluoridated water. Those areas in blue in Rhode Island do benefit from fluoridated water, so that's really kind of the best drink. If you're in an area where you don't get fluoride, talk to your dentist or your physician about fluoride supplementation. Okay, so I think we've shown a lot, and I think I'm going to stop now and stop sharing and ask you guys if you have any questions. Or
And
what,
thank you so much for going through all that information. I know it was useful to hear it for myself, and I think a lot of the families that Kelly and I work with, and families out there in general, are really going to benefit from the wealth of knowledge that you shared. But Kelly and I do have some questions that families shared with us, common questions that we tend to get. So I figured we could kind of go through those and see if you have any advice
perfect.
related to those questions. Perfect. So one of the big questions we get is, how can a family find a dentist for their child?
Okay, great. So, I mean, I'd say first, if you have a family, often it's good to ask a family friend, ask among your resources the school nurse, or if you go to Head Start at Ask at Head Start. If those come up empty, I'm going to show you the Department of Health Oral Health Program webpage where we have a Find Dental Care link. So I'm going to go back and I'm going to share my screen again. And so this is our, are you seeing our oral health program web page now?
Yes.
Great. So yeah, I'd encourage, this is health.ri.gov/oral health. And under here, it says we can help you find dental care. And if you click here, it gives the names of some of the community health centers. Many of the community health centers have dental clinics. You can also see dentists near you. Let's do that again. Find dental care. You can also go to your town. So if you're in East Providence, for example, it might list some dentists in East Providence. Couple other resources to show you. This is teethfirstri.org. These are some of our partners at Kids Count, and they have, if you go to Parents and Families, it'll give some resources here. Find a Dentist, Age 1 Dental Champions. So that's another resource. The other resource I wanted to share is the Rhode Island Medicaid program for children. It's called Right Smiles. And if you go to the Right Smiles webpage, which is uhc.com/rightsmiles, I think that's it. They should have resources also to help find a dentist. So right down here, find a dentist. So those are some ways. You can also call Right Smiles, and they'll help you find a dentist. So those are a few examples.
Great. Thank you so much.
Thank you so much. And just to echo what Paige said, thank you so much for doing this. I actually learned so much, especially about pregnant women and just dental care really for the whole family and how important it is and how it really affects our overall health for our entire bodies. It's so important. But a couple of the questions that we had prepared, you did already answer in the presentation, but I wanted to ask, what are, besides caries, what are some common dental issues that you do see in young children? And what should a parent do if they are having issues with their teeth or gums?
So yeah, dental caries we talked about, and we do sometimes see some gingivitis in young children. It's rarer in children, but certainly gingivitis could actually be a warning sign of something systemic. So definitely if a parent sees that the gums are puffy, sure, try to brush and floss better, but I think if it's been a while since a dental appointment, I would get the child in to see the dentist. So children should be going every 6 months to the dentist. Yeah, I would say those are the two main things. But again, know what normal looks like, and then if you see abnormal, go to the dentist. Even in one of the pictures I showed sort of what they call white spots or sort of white shadows. That's the earliest phase of tooth decay. So if you see something like that, go to the dentist. The other thing I didn't mention was what happens at that age 1 dental visit. I said you get comfortable going to the dentist, they provide guidance, but one thing I also want to share is something called fluoride varnish. Fluoride varnish is another way to strengthen the teeth and another way to prevent tooth decay. And fluoride varnish can actually be provided up to 4 times a year. So if somebody's high risk, they can have it provided 4 times a year. Some primary care physicians do it. Actually, at your, quote, regular doctor, they can do that preventive effort as well.
Great, thank you.
So I know during your presentation, you mentioned that children should be seeing the dentist as early as a year old. I know just from chatting with Kelly, we've heard from families previously that sometimes they're hearing mixed messages. So we didn't know if there was any recommendation for what to do if a family is seeking out dental care at a year old for their child and they're being told by the dental provider that they won't see them yet.
So I guess what I would say is if it's your family dentist, I like the idea of going to your family dentist, okay? Say you've gone to your family dentist for years, now you have a child and you want to start bringing your child and your family dentist says, no, I don't see children. We'd be happy to talk to them, so, or, however we can educate them, we can provide some information about that knee-to-knee exam that some dentists may not be aware of. They may not be aware of the early visit, so we're happy to educate them. If you're calling a dentist out of the blue, not your regular dentist, and they say, I'm not going to see young kids, then again, I'd suggest going to that Teeth First RI website. I will say there are, just like we have family medicine physicians and we have pediatricians, there are dental specialists called pediatric dentists, okay? And years ago, again, thinking 30-something years ago, they were very rare. Maybe we had 4 pediatric dentists in Rhode Island. And they really just saw sort of the more difficult, the children who weren't able to cooperate. But now we have probably have about 30 maybe pediatric dentists in Rhode Island. We actually have we're fortunate, we have a pediatric dentistry training program at St. Joe's in Providence. So the good news is every year we're training more. Hopefully they stay in Providence. I can't say they all stay in Providence, but we have more pediatric dentists. So those are dentists that are probably more comfortable with children. So you could definitely call one of those dentists.
Awesome. Thank you so much.
At what age should parents start brushing their teeth, and what does that look like, especially for a younger infant?
Yeah. So let's see. I'm going to see if I can find my friend here. Oh. So this is my friend Melvin. Okay, and let's see if I can do this. This is the virtual version. So if you put your child in the lap, and then you may want to take so we're doing this on the floor, except I'm not going to get on the floor and show you, but if you take one leg and just sort of hold their legs, and then just look down at your child just like this, and this is my big toothbrush, and you can brush like this, brush on the outside first. I always say do the outsides first, because sometimes if you start with the inside, it can lead to gagging. And then go brush on the inside. So again, early on, just wipe the gums. But as teeth appear, start to brush. And again, the position would be having the child in your lap, and the parent takes their legs and sort of covers their legs to keep them in position. And you can do this on the floor, or wherever, or on a bench, wherever, or on bed, whatever you're comfortable with.
Great, thank you.
You bet.
And when parents do start to brush after that first tooth erupts, should they be using the fluoride toothpaste at that point, or is that at the year mark?
No, I'd say use a toothpaste, use a fluoride toothpaste, but just use a small amount, just like a rice grain size.
Is it safe to swallow for children that can't spit?
Yeah. I mean, I think it's a very small amount, number one, And yeah, I know, it's funny. I know toothpaste say that if you swallow, go to the emergency room. But I've spoken to people who work in the emergency room. I said, have you ever seen problems from people who come in that they've swallowed toothpaste? And they said, we've never. One physician said, I've worked in a hospital for 30 years. I've actually never seen anybody coming in because they swallowed toothpaste. So I don't know. I think it could even be more from just other ingredients, but we don't know of harm that can be caused by swallowing fluoride toothpaste.
Okay, great, thank you. I know that's been a concern with a lot of parents. When I do some education with parents of infants, is their preference is for a non-fluoridated toothpaste. And that concern of what if my baby swallows, she doesn't know how to spit. So thank you.
Yeah, so I would say I'd say just use small amounts, and yeah, fluoride toothpaste has and fluoride in general just has a record of safety. I know there have been some papers out there. There are people who tend to question the benefit of fluoride or the safety of fluoride, but we have 50 years of safety. So I think the data continues to show that people have been safe with fluoride.
Great, thank you. I had another question too. How has COVID impacted dental visits and dental care in Rhode Island?
That's a great question. It's been a tough year for both the dental profession and ultimately the oral health of Rhode Islanders. It's something we actually worry about a lot. I mean, just talking about dentists, that early on, they were not providing preventive care. And this was tough for a lot of offices, and unfortunately, a lot of dentists may have retired. So unfortunately, it may be harder to get in to see the dentist now. The dental offices, there was a lot we just didn't know, but now we know that the record of safety of dentists, just because dentists have always practiced really good infection control, dentists have always worn masks. I think one of the things, some dentist offices had to look closely at their ventilation systems and make modifications, but many of them did. So, and the other thing is, I think things started taking a little bit longer just because of processes related to COVID-19. So I think people have not been going in, but people really can feel confident that it's a record of safety. I don't think there's any concerns about transmission as long as the offices are following proper protocols, which they are. So again, I think the downside is that there are a lot of people who've gone without dental care, and so we hope they'll start getting back into the dentist. We also know that a lot of children, because of learning from home, they had quick access to snacks that might have caused tooth decay. So we worry about that. So we hope people will start going back to the dentist.
How would you suggest a parent that has a child that does have cavities or caries and obviously needs to get that addressed, and it's a situation in which the child might need to be sedated? How do you suggest that parent advocate when there are so many ORs that are closed to dentists right now because they're trying to get all those appointments in that were put off because they weren't what is the word? I don't want to say essential, but yeah, they weren't mandatory.
Yeah. So certainly children who have significant, decay on every tooth, which again, we hope we can avoid that, but we know it does happen, that getting that care often in a hospital setting is the most effective way. But we know that it's hard now because of demand for care and hospitals just trying to deal with pent-up demand. Again, I would say get in with a pediatric dentist. I will say if they have Medicaid, it is the responsibility of the managed care program to make sure that their treatment is moving along. So if they're not getting satisfaction through their dental provider or their dental insurance, talk to the primary care physician for them to reach out to whatever medical insurance they have, because it can start to become a medical issue. So if they have Neighborhood or United or Tufts, any of those programs, they should try to bring it to their attention, because there are case management services that they can help with. The other thing I want to share, there's actually something new in dentistry, actually new to the United States. It's been in many of the countries in Asia for a long time, called silver diamine fluoride, or let's just call it SDF. But it's a version of fluoride with a silver in it that actually arrests tooth decay. And have you heard of this?
Yes, I have. I just didn't know what it was.
Yeah, and what it does is it's painted on the tooth. It's super easy. It's just like a little liquid. The dentist paints it on the tooth, and it stops the decay. And I will say, it turns the cavity black. Now, it's a sort of a small price to pay, but we've never had something that can actually stop the decay process. So this can help buy some time, okay? So it can help put out some of the fires so that the dentist then can maybe address one tooth at a time. So instead of saying, okay, I have to take you to the hospital to treat you under general anesthesia, I'm going to now just put this silver diamine fluoride on all the cavities. That'll stop the decay. Now bring your child in, and maybe we'll do one or two teeth at a time. Get your child comfortable with going to the dentist. I actually don't do much regular dental care anymore, but years ago I used to say to parents, I would love it if your child has a successful dental experience. If we can do one or two fillings now and your child does well, that's going to help their confidence for life, and they're not going to be afraid of going to the dentist. So let's work together. Let's make a dental visit, going through the action of getting numb, getting the drill, getting the filling. If all of a sudden this is nothing to them, you've given them something for life. So I would prefer not to have to treat a child under general anesthesia. I'd prefer that they can have a positive experience, so that it's like your, what's the word? There's a term you're building their self-efficacy, I think.
Thank you.
No, and I think it's so important that you bring that up, because I think a lot of adults have that negative connotation of dental care. So if you can start that early and have it be a positive relationship, make them feel comfortable, and it's not so much of a stressful situation, and it'll benefit them in the long run.
Right. It's part of life.
Mm-hmm. So I believe that you have actually touched upon all of the questions that we had received. A lot of your presentation covered those. So again, we really appreciate you sharing all your insights, and I think all these resources are going to be great for families to utilize moving forward.
Fantastic. Yeah, and I'd encourage everybody, visit our website, health.ri.gov/oral health. There's a lot of resources there for children, for adults, and hopefully can answer people's questions. And we also have our email address. If people have any questions, they shouldn't hesitate to reach out. We're here to help.
Fantastic. Thank you so much. And this is magic. He really likes conference calls.
Okay. Magic, meet Melvin.
But thank you very much for your time and for answering all of our questions today. This was a fantastic presentation. So informative. We really appreciate it.
Thanks, guys. All right. Have a good day.
You too.
Bye.
Thank you.